Hi, I'm Dr. Lindsay Tubaugh.
And I'm Dr. JJ Wicker, and we are the owners of Little Heroes Pediatric Hearing Clinic.
Hearing differences and disorders impact children starting at birth, or they can develop later in life.
Regardless of when they begin, once they do, there is a shockingly large lack of information out there for parents and professionals that could help drive better care for children with hearing differences, both clinically and at home.
That's why we're here, to talk pediatric audiology. Our aim is to discuss everything from how we test infants to sound sensitivities in children who don't even have hearing loss.
Our goal is to support you and others. The best way we can do this is having you like and subscribe to our page and share what we have to say.
So keep in touch and look to Little Heroes Pediatric Hearing Clinic for information and resources. We're here for you. Hey everyone, I'm Dr. Lindsay Tubaugh, and this is Dr. JJ Wicker.
Hello!
And welcome to our
A new one. It's another one.
It's another coffee talk. And today I'm really excited about the discussion because we're going to be talking about one of my favorite things, which is how we're able to test kids who are 6 months of age plus in really fun ways. A lot of parents call and one of the biggest things they say is, well, my kid is not going to respond to sounds, so you're not going to be able to test their hearing. And I am like, nope.
Bring it on.
Bring it on. We love this stuff. It's so much fun. So that's what we're going to be talking about today. But before we do, be sure that you subscribe and like and hit that little bell so that you know when a new video comes out.
So I think bring it on. Like, we say that not to be aggressive, but because that's part of being a pediatric audiologist. When you work with children all day, every day, you learn how to read their behaviors, I think, and you learn what they like, and you can quickly gauge, like, how am I going to get this kid to interact with me? Because it can be nerve-wracking, I think, as a little toddler to walk in and say that, you know, your ears are going to be touched left and right. That can be kind of rough.
For sure. And, you know, one thing to keep in mind is that we have a lot of experience testing very difficult to test populations. So even if your child is very ear defensive or kind of clams up, a lot of times we can find a fun toy, or you can bring a fun toy from home that they're very familiar with, and we can utilize that in our test protocols.
And really emphasizing, parents, one of our value statements or mission statements, I don't really know what the difference is that parents are the experts, and we're going to follow your lead a lot of the times. If you come and you say, you know, my daughter really likes music or really likes Moana, like that, we're going to tap into that and we're going to use that to try to help engage the child.
Yeah, but one thing that you definitely can do prior to your appointment is to start touching your child's ears. Get them used to something touching their ears, because we do need to look at their ears, and there are some tests that we'll require to get the best results for something to be in or around their ears. If they absolutely won't tolerate it, we can work with that. But practicing at home in a safe environment definitely will lead well into getting hearing testing done in an environment that is new to them.
Yeah. So let's talk about how we know when a child is at least ready to do booth testing. Because in our last video segment, we talked about infant testing. And obviously, when we're working with infants, we have to do it differently because they don't have a way to tell us that they are hearing sounds. And this is now, we're working with a group of kids who can. And you might be thinking, well, it's my 6-month-old still can't say, oh, I hear the sound. And that's a really good point. And again, we're not looking at that. There's different things that we can look at to know whether or not a child is detecting sound. And for this particular age group, infants and toddlers, that's essentially what we're looking at, is their ability to at least detect sound and show some sort of behavioral sign that they detected that sound.
Yeah, so let's start with the youngest population, or a population that maybe is a little cognitively delayed and needs this type of testing. What we do is we have, if the child's old enough to sit in a high chair or on a parent's lap, they can be tested. And so with this type of testing, it's called VRA, which stands for
Visually Reinforced Audiometry.
Yes. So we go into the sound booth. We have the child sitting on your lap. If they're older, they can sit in a chair, or they can sit in their wheelchair if they're in a wheelchair. And essentially, we're sending sounds. A lot of times we'll either start with sounds in the room, or if they'll tolerate headphones or little inserts in their ears, we'll put sounds into those. And what we're trying to do, we do a few practice sessions where we're trying to get them to look towards the sound. And then we have reinforcers, which is why it's called visual reinforcement,
Yeah.
audiometry. So once they look towards the sound, they get a video or something lights up, something exciting to help them, and then we praise them like crazy. Yay,
Yes.
good job!
Yep.
And then that excites a child. Of course, their attention span can sometimes be a little short, so we're sometimes in a rush to get as much information as possible.
We can, and because of that, sometimes the ideal is that they do physically turn and look, and that's why we say that a kid is a candidate if they have good neck and trunk support. You might hear that a lot from your pediatric audiologist. And of course, like I say, we do want them to eventually turn and look for the sound because that's the clearest signal that we can get. However, sometimes kiddos might, especially when they have those inserts, and I've noticed like they're really good when the sounds are coming from the speakers, but when something is touching their ears, they seem to like freeze up. And when that happens, there are other ways for us to know. I think the most common is you see this really obvious eye shift where like the kid will freeze. They might even be babbling a little bit, like blah blah blah, and then they'll just hear the sound and freeze and just shift their eye over to the direction. That's considered a response, and in those cases we'll flash those lights, and that's what might help drive them to actually turn their head. So if you're sitting in the booth and you're like, my kid didn't turn their head, just know that there are other things that we can be looking for.
And typically best practices, we test those frequencies multiple times, so we're not just looking for that response one time, that they heard it, and we call it good.
Right.
We go over those to make sure that we feel comfortable in calling it. Let me tell you a quick story about a little kiddo who she came into my clinic. She was a little bit older, but was a little more low functioning. I believe she was 6, had Down syndrome, and she was such a joy to test. We used this type of test technique because we had tried a different test technique that didn't work. So we went to this test technique, and she would not look towards the sound, but every time she heard a sound, she would start to dance.
That's
and so
cute.
It was so much
That's
fun,
so
and
cute.
it was such a joy to test her. And so there really are a lot of different ways that we can look for responses in children using this type of test technique.
And I think that the reason why we just call it VRA is because, again, we have that visual reinforcer.
Yeah.
That's how we try to train children. But yeah, we can look at for all sorts of different things. So if you're concerned that your child might have hearing differences and you're like, man, I can't get him to sit through something. Again, that's why you find a pediatric audiologist. This is what we do. This is what we live and breathe. And a good pediatric audiologist will say, bring it on.
Yeah, I agree. We kind of like the challenge. We like puzzles. We like to have fun, and we like to know what inspires and motivates your child. And also, it's very common for us to try different techniques. And if a kid gets bored, we might go into another room, play a little bit, and then come back and get some more testing. It's also important to understand with this population doing this type of testing, sometimes it does take a couple of visits. Coming into the clinic with your child in a good mood, if at all possible, either well fed, having had a nap, bringing them in when they're not feeling well or they're super tired, it's been a rough day, you're probably not going to get a very good hearing test.
Right.
Also bringing in siblings, while I know it's very difficult sometimes to get somebody to watch other children in the house. Both JJ and I have 3 boys. We understand this. But if you can come into the clinic with your child, with just your child that's getting tested, it can go a long way, because then we really can focus all of our attention on your child, and you can focus all your attention on your child, and we involve you in the testing process as well.
Yep. So that's, I think, it for this segment, infant toddler. So again, if you have any questions, please go online. We have littleheroeshearingclinic.com, but always please like and subscribe to this page to get more information and share with your friends. And something about a notification bell.
Yeah, push the little bell and you'll get a
go.
notification. And just remember, there is no child that cannot be tested for hearing acuity. So regardless of your child's age, their abilities, they can be tested for hearing, and the sooner we test their hearing to make sure that they have normal hearing, or the sooner we make a diagnosis, the better outcomes you're going to have for your child. So never hesitate to come in fearing that we're not going to be able to test your child. We'll figure out a way to do it.
We will. I hope you have a great day.
Bye.